What is the drug of choice for febrile seizures in children? Diazepam, phenobarbital, paracetamol, none of these. Correct answer is option A, diazepam. Which sign is most indicative of deep vein thrombosis? Vein with dorsiflexion of foot, absent pulses, cool fell extremity, bilateral leg swelling. Correct answer is option A, vein with dorsiflexion of foot. Which is a priority assessment after a femoral cardiac catheterization? Respiratory effort, urine output, fetal pulse, bowel sounds. Correct answer is option C, fetal pulse. A patient with peptic ulcer disease is vomiting coffee ground emesis. What does this indicate? Recent hemorrhage, upper GI bleeding, lower GI bleeding, intestinal obstruction. Correct answer is option B, upper GI bleeding. A patient post thyroidectomy is showing signs of hypocalcemia. What is the priority intervention? Encourage ambulation, administer calcium gluconate, provide oxygen therapy, start IV fluids. Correct answer is option B, administer calcium gluconate. What assessment finding indicates a hemothorax rather than a pneumothorax? Absence of breath sounds, hyperresonance, tracheal deviation, dullness to percussion. Correct answer is option D, dullness to percussion. Which lab test confirms pancreatitis? Bilirubin, lipase, ALT, creatinine. Correct answer is option B, lipase. Which type of incontinence involves sudden leakage with coughing or sneezing? Urge, reflex, stress, functional. Correct answer is option C, stress. Best site to assess skin turgor in elderly is forehead, back of hand, abdomen, sternum. Correct answer is option D, sternum. What complication should be monitored after gastric surgery? Diarrhea, dumping syndrome, GERD, constipation. Correct answer is option B, dumping syndrome. Which color urine suggests hematuria? Reddish brown, straw yellow, light pink, none of these. Correct answer is option A, reddish brown. What is the normal fetal presentation in labor? Breech, transverse, cephalic, shoulder. Correct answer is option C, cephalic. A lumbar puncture is used to diagnose brain tumors, stroke, epilepsy, meningitis. Correct answer is option D, meningitis. Which is the most potent vasoconstrictor in the renin-angiotensin system? Angiotensin 1, angiotensin 2, renin, aldosterone. Correct answer is option B, angiotensin 2. The correct position for a rectal suppository insertion is prone, supine, left lateral, Fowler's. Correct answer is option C, left lateral, Sims. Which condition is associated with moon face, buffalo hump and central obesity? Hypothyroidism, Addison's disease, hyperthyroidism, Cushing syndrome. Correct answer is option D, Cushing syndrome. A patient with Addison's disease should be monitored for hypoglycemia and hypotension, hyperglycemia and hypertension, hypernatremia and dehydration, tachycardia and fluid overload. Correct answer is option A, hypoglycemia and hypotension. Which electrolyte imbalance is common in patients on low diuretics? Hyperkalemia, hypokalemia, hypernatremia, hypercalcemia. Correct answer is option B, hypokalemia. Which white blood cell type is elevated in allergic reactions? Neutrophils, monocytes, eosinophils, basophils. Correct answer is option D, basophils. In hyperparathyroidism, which complication should be monitored? Hypocalcemia, bone fractures, seizures, tetany. Correct answer is option B, bone fractures. In Kawasaki disease, the major complication to monitor is renal failure, liver damage, coronary artery aneurysm, hypoglycemia. Correct answer is option C, coronary artery aneurysm. Which congenital defect is associated with a machinery-like murmur? Patent ductus arteriosus, ventricular septal defect, atrial septal defect, none of the above. Correct answer is option A, patent ductus arteriosus. Which is the shortest stage of labor? First, second, third, fourth. Correct answer is option C, third. The third stage of labor typically lasts 5 to 30 minutes, 30 to 45 minutes, 1 hour, 2 hours. Correct answer is option A, 5 to 30 minutes. What is the average duration of the first stage of labor in a Freemi gravida? 46 hours, 6 to 8 hours, 10 to 12 hours, 14 to 16 hours. Correct answer is option C, 10 to 12 hours. Which hormone initiates puberty in adolescents? Thyroxine, insulin, cortisol, GnRH. Correct answer is option D, GnRH. What is the purpose of incentive spirometry post-operatively? Prevent atelectasis, improve oxygenation, reduce pain, detect infection early. Correct answer is option A, prevent atelectasis. Which of the following instruments is used for fetal monitoring during labor? Sphygmomanometer, fetoscope, laryngoscope, otoscope. Correct answer is option B, fetoscope. A child with Down syndrome is at increased risk for congenital heart disease, type 2 diabetes, asthma, bone fractures. Correct answer is option A, congenital heart disease. What is the hallmark symptom of Parkinson's disease? Diplopia, muscle flaccidity, intention tremors, resting tremors. Correct answer is option D, resting tremors. In managing a child with diarrhea, the most important action is antibiotics, fasting, oral rehydration therapy, antidiarrheal drugs. Correct answer is option C, oral rehydration therapy. Which medication is used to reverse the effects of heparin? Protamine sulfate, vitamin K, naloxone, atropine. Correct answer is option A, protamine sulfate. What is the priority nursing action after a torasynthesis? Ambulate the patient, assess lung sounds, give IV fluids, administer antibiotics. Correct answer is option B, assess lung sounds. What is a priority nursing intervention for a patient on total parenteral nutrition? Monitor blood glucose, check protein levels, monitor blood pressure, encourage oral fluids. Correct answer is option A, monitor blood glucose. What is the primary complication of peritoneal dialysis? Fluid overload, peritonitis, hypotension, hypokalemia. Correct answer is option B, peritonitis. The most common cause of preventable childhood blindness worldwide is vitamin A deficiency, congenital cataract, retinopathy of prematurity, trachoma. Correct answer is option A, vitamin A deficiency. Which finding is associated with dehydration in children? Increased skin turgor, dry mucous membranes, increased urine output, none of these. Correct answer is option C, dry mucous membranes. A sign of early increased intracranial pressure is bradycardia, dilated pupils, confusion, none of the above. Correct answer is option C, confusion. Thanks for watching. Subscribe to the channel for the latest informative MCQs.